Here I am with Dr. Cesar Cafati, who is an expert on assisted reproduction. Dr. Cafati, thank you very much for being today with us. My first question is, how do you know when a couple is suitable for having an AR treatment?
First, you have to be sure that that couple, they really have a fertility problem. If they really need treatment, then you have to establish a diagnostic. You have to know why they could not have babies. Then you have to study during 1 month all the factors that are involved in infertility, male factors and female factors. And finally, you get to know what the really problem is. In some cases, they need easy treatments. In some cases, you only need to operate the patients or to do some special treatments with drugs. But in other cases that are more complex, then you have to go to the assisted reproductive technologies.
My second question is, have you ever denied to treat some patients? Why?
Yes, I have denied to treat gay couples, treat women over 50 years old, to treat single men, and in few cases single women. Why? Because I think that this country, and for ethical reasons, under my point of view, we are not prepared to give a baby to those couples. This is not only a matter that I want to have a baby, it's more than that. It's where the baby is going to be born, how the baby is going to grow up, and the society that's involved in these cases. I personally am not prepared to treat those couples.
My last question is, how do you deal with frustrated patients when the treatment didn't succeed?
The patients must know from the beginning that this is not like a simple surgical procedure. This is something that has to deal with the statistics. And there are a lot of factors involved. The age of the woman, the cause of the fertility, and the number of attempts they have done before. If I have a really difficult couple, then I have to be sure if here in this country we have all the procedures that they need. For instance, there are some patients that they need what's named a PGD, a prenatal genetic diagnosis. And in Chile, we're not doing that. So what you have to do is to be clear with the patients, to give the reality of numbers. For instance, all the patients that goes to your office, only about 35% of them are going to finish with a baby in their arms. And in some cases, they have to choose for oocyte donation or egg donation, or to adopt a baby. The best thing that you have to do under the ethical point of view is to give a good advice for the patients. And the main thing here is the capacity of giving love. And it doesn't matter if it's your own egg or you don't want an identical. What you need or what you want is a baby to love and to raise up. So I think that in some cases you have to stop doing treatments because you can do psychological problems to the couple. And the best advice is to say to the parents, stop. This is not the way to have a baby, and take a final decision.
Thank you very much for answering my interview.
It was a pleasure, Stefano.